Hello, everybody. This is Tony with Safe Kids in DC. Welcome to everybody to this webinar on ATVs and OHVs in public policy. We're here today because, first of all, it's a recognition that this is a growing risk that is facing all of us, but a major risk involving kids. And it also has an interesting public policy challenge as well, if not several. Before I introduce very briefly our presenters today, I just want to ask you to please consider asking a question. And you do that by going on the chat facility on your computer. We really try to develop these so that there's time at the end for questions, because you are the reason we're here. Just to very briefly introduce our presenters, because Ruben sent out bios of everybody. We have two people with us with Consumer Federation, which is perhaps the foremost organization in not only the U.S. but the world on consumer product safety and consumer safety. We're going to start out with Michael Best, who is the Senior Policy Advocate with the Consumer Federation. He's going to be helping us with some of the data around this risk. Michael is a lawyer. Don't hold that against him. He's been with Consumer Federation since 2013. Now, Rachel Weintraub is also with Consumer Federation. She's the legislative director and the senior counsel. I think of Rachel as sort of the Yoda that a lot of us look to on these issues, and she has an amazing amount of respect people hold for her on these issues, and we're lucky to have her join us today. Also on the call is Dwayne Smith, who is the coordinator of Safe Kids Colorado out of Children's Hospital of Colorado. I guess in a way, Dwayne really helped me understand the importance of this issue. I was out in Denver, and he took me to a hearing of the legislature on ATV bills, and you know, I could see, you know, first of all, the power stacked against us in meeting this challenge, but also the value that that exists when we use data, and especially economic data on issues like that, because it really it was the one thing that made the legislators on the hearing panel perk up on our side of these issues. And I probably shouldn't have said our side, because we're not advocates on this, but on the side of smart policy when it comes to ATVs. And lastly, presenting will be Beth Barnes from Safe Kids Vermont. She's with North County Hospital. I promised when I kind of hooked her into doing this, she was in DC about 3 weeks ago, that I wouldn't tease her about the Bernie factor of Safe Kids Vermont and what's going on in the primary campaign. She's going to talk to us about the role of education and awareness on this issue. So start out by going to Michael. Thank you.
Thank you, Tony. First slide, please. So, as Tony said, I'm Michael Best, Senior Policy Advocate at CFA, where I work with Rachel on product safety, specifically around the dangers of on-road use of off-highway vehicles. And I'm going to briefly give sort of a data overview, some government data sources, but mostly actually CFA's own data sources. As part of this work, there's sort of a public policy component that Rachel's going to talk about, but there's also sort of a data component. We've started gathering our own data to sort of see what kind of vehicles are causing these fatalities and where it's happening. Next slide, please. So just the briefest of overview, I always say OHVs, off-highway vehicles, and the two main subtypes of those that we're talking about are the ATVs that I think you generally think of, the straddle-type seating, the handlebar controls, but also we're seeing a lot of what we call ROVs, recreational off-highway vehicles, that have the bucket seating, a steering wheel, usually some kind of roll cage, and a maximum speed over 30 miles per hour. So those are and those will have also passengers, which ATVs, the straddle type seatings are not generally designed for. So those are the two main kind of vehicles I'm talking about when I talk about OHV. Next slide, please. So this is National Highway Traffic Safety Administration Fatality Analysis Reporting System data, which is a mouthful, which is why we call it the NHTSA FARS data. So this is just on-road deaths. That's what they report from 1982 to 2013. There was a peak of 377 deaths on the road in 2008, with the trend kind of going down. You can sort of see it sort of sloping down, though it started to tick up again. You can see right at the end there in 2013 with 319 deaths. So, we don't know why. I mean, some people posit that you see sort of a lull during an economic downturn. It could be that. It could be totally unrelated. But we are starting to see an uptick again. Next slide, please. Now, the other main government source of data, of course, is the Consumer Protection Bureau, the CPSC, and that's both on-road and off-road data. And both of these data sources are just ATVs, not ROVs. And you can see that this is 2009 is when this slide was made. 2009 was the most complete CPSC data set that we had, though they recently released data that's complete up to 2011. You can see there's also a downward trend there. CPSC data, so that's on-road and off-road, peaked with about 900 deaths in 2007 and is down to 700 deaths in 2011, which is now the most complete year. And so you can see there's kind of a bit of a data lag there. So there's about a half-decade data lag between the most complete CPSC data and the year we're at, right? We're in 2016 now. So that's one of the reasons, as well as wanting to find sort of slice the data as finely as we could, that our coalition that we work with on this of researchers and advocates started compiling our own data. Next slide, please. And we get those through Google News, CPSC summaries, NHTSA Fatality Analysis Reporting System data, OSHA data, state, county, and local law enforcement crash investigations. There are a few states that actually keep pretty good track of this stuff that have easily available data. So we bring all these together, and we're doing this as much in real time as we can. And I'm going to talk now about our 2015 data to give you a sense of what's happening on the roads, off the roads, what these accidents, fatalities are looking like. Next slide, please. Oh, well, it looks like we have a data problem, so you can't see it, but that's okay. I will read it off. So the blue category is ATVs. We have 506 deaths total, January to December 2015. 80% of those are ATVs, which isn't surprising. The orange slice is ROVs. 15% of the fatalities in 2015 were ROVs. That's sort of the bucket seating, the steering wheel. So a significant piece of it, and one of the reasons, of course, that we wanted to develop sort of our own data set is that the main government data sets aren't capturing that yet. Next slide, please. Oh, good, the percentages are here on this one. So as you can see, and this is borne out in the government data too, most of the fatalities are happening on the road. 55% of ATV fatalities, 53% of ROV fatalities. And that's really what's driving the policy piece of this that Rachel's going to talk about. So, getting the message out, changing the law, because most states do allow, as Rachel will talk about, these vehicles to operate on roads, would have a serious impact on fatalities and reducing fatalities. Next slide, please. So, as you can also see, for ATVs, the vast majority of fatalities are drivers, which makes sense. They're not designed, of course, to have passengers at all, but you still see 9% there of the fatalities are passengers, because people are riding them even though they shouldn't be. Much higher percentage, 36% of ROV fatalities are passengers, which makes sense. Again, they are designed to have passengers. Next slide, please. So this is ATV and ROV related deaths by age group, and as you can see, 33% of ROV deaths we found were under the age of 16, which is a really we were surprised by, but it's a really shocking statistic. A significant amount of ATV deaths as well, 18%. And you can sort of see that breakdown as you go through. I mean, so it's fairly well distributed, but very high for ROVs under 16, very high for ATVs under 16 and 20 to 29, and a not insignificant amount 16 to 19 too. So in that whole younger spread, really, it's quite high. Next slide, please. So this is ROV deaths by type of crash. So 88% of them you can see are single vehicle crashes. The one missing there, the orange, it's 11%, are a crash with another on-road vehicle. Of the single vehicle crashes, 75% of them involve a rollover at some point. And of those, 48% of the occupants were pinned or rolled over by the ROV. So rollover is a really big piece of this. I mean, these are pretty unstable vehicles and made much more so when operated on roads. Next slide, please. So ATV deaths by type of crash, 77% single vehicle, 12% hitting an on-road vehicle. Of the single vehicle crashes, 48% include rollover. And of those, 52% of those were pinned or rolled over by the ATV. So again, rollover, instability being a big piece of this. Next slide, please. So here is helmet use in ATV and RV fatality crashes. So as you can see, the unknowns are really big here. This is sort of the biggest hole in our data set. I mean, we're relying on these reports, Google News, as we told you. So, I mean, definitely a high percentage, we know, though. 30% of ATV riders aren't wearing them. 39% of RV riders aren't wearing them. It could be a lot higher, but that's just a piece of data that's been hard to get reliably, so it's mostly unknown. Next slide, please. And this is seatbelts for ROVs. Of course, only ROVs would have them. Again, a high number of unknowns, but we know at least 50% of these crashes we're talking about were not wearing belts. So with that sort of data snapshot, I'm going to hand it over to Rachel to talk about the policy component. Thank you.
Hi, good afternoon. So glad to be able to participate. And Tony, thank you so much for the very warm introduction. My 11-year-old will adore the comparison to Yoda and likely disagree with you. He will love that. So I am so pleased to be able to speak to you about off-highway vehicles and the growing safety crisis of on-road use. Next slide, please. CFA has been working on these issues for many, many years. I've been working as Legislative Director and General Counsel at CFA for many years, and ATV safety has been a priority. Next slide, please. Today, I want to talk to you about three things. An overview of our off-highway vehicle on-road research, our OHV advocacy work, focusing on keeping OHVs off-roads, and strengthening our coalition. Next slide, please. So we have been working on this issue and looked at what was going on and felt, and others shared this belief, that anecdotally there were more ATV incidents on roads, and it seemed like there were more states that were permitting ATVs on roads, but there was no documented evidence that that was the case. Next slide, please. So on the one hand, there are numerous types of state regulations already. Those of you who work in the states are likely familiar with some of these types of regulation, whether it's a minimum rider age. Some states have ages as low as 8 to 10. Others have what we perceive as stronger as 16 years old. There are helmet requirements. And some of them, and this is really the crux of our work that we want to share with you, is where OHV riding is permissible. Next slide, please. So what we did, in fact, was conduct research to see if our sense was right, if our anecdotal perception was correct, that there's a growing safety hazard, that more and more states and more counties are moving to allow OHV use on roads. And in fact, that's what our research documented. So there definitely is a growing safety hazard from ATVs on roads because most states now allow ATVs on roads, even though ATVs are specifically not designed for on-road use. And this is an issue within the ATV advocacy scope where there is agreement between industry regulators, public health advocates, that ATVs do not belong on roads. And as Michael said, in many different ways, most ATV and ROV deaths actually occur on roads. So here it is, there's this growing trend that is contradicting what we're seeing in terms of public health research. Next slide, please. So the first point, that OHVs are not designed for use on roads. The risk of tipping, it increases on roads, and their tires are low pressure tires, and they are not suitable for road use. Next slide, please. And SVIA, the Trade Association for ATVs, includes messaging on, there's labeling on ATVs, there's information in their manuals, they have policy statements that confirm that ATVs should not be operating on roads. And there is consensus between CPSC, CFA, and other public interest consumer public health organizations and SVIA that OHVs are unsafe on roads. Next slide, please. To dig down a little bit deeper into what our research found, we found, and we've done two stages of this research. The first, in 2013, focused on ATVs. The second, in 2015, focused on ROVs, recreational off-highway vehicles. And what we found was that the information was identical, that wherever ATVs are allowed on roads, ROVs are also allowed on roads. And this includes 35 states. Next slide, please. 69% of states allow ATVs or ROVs use on public roads. That's a really high percentage. Next slide, please. We also looked at whether, in fact, this was a growing trend, a more recent trend. And we found that, in fact, it was, that since 2004, 63% of states with ATVs on public roads passed laws to allow or expand use. Next slide, please. And this is a very important aspect that makes it a challenge in terms of advocacy, is that 89% of states with ATVs on public roads allow localities to make decisions on ATV road use. What this means is that there are state laws that allow for the delegation of decision-making on ATV on-road decisions. So that means that counties, municipalities, smaller entities make decisions, can pass ordinances determining whether an ATV or ROV can go on a road. That means, in terms of advocacy, it's hard to figure out what's going on. We know firsthand that some of these places don't even have websites. It's hard to find out what's happening. We rely on Google Alerts. But also it means that there's a huge patchwork within some states. So in terms of a consumer, to try to figure out where it's okay and where it's not okay, it's very complex. Next slide, please. So what we need to do to reverse this trend is multifold. Clearly, a strong prohibition on off-road riding, but there's pieces to this. Limited work exceptions, penalties sufficient to deter, restricting riding on all rights of ways, enforcement mechanisms. In order for a law to really work, there needs to be these clear enforcement and deterrent mechanisms. Next slide, please. Here's an example of a very strong state prohibition, and CFA was not involved in passing this law. Maybe some of you are from Delaware and were involved, but it's really what we think is a great model. OHVs are prohibited on the entire right-of-way. There's no riding on the shoulder of the road. We think that's important and consider that in our analysis. OHVs are only allowed on roads for narrow exceptions, for parades or other special activities, and there's fines and impoundment. So that means, and we've heard from sheriffs and others, that if they don't have the ability to fine or impound a vehicle, that they really can't enforce the law. Next slide, please. So what are we doing about this? We have organized a coalition since the release of our first report, and we have what we call our ATV Action Center. We have sent 61 letters since April 2014 in opposition to state, county, and municipal ordinances at all different levels, including the federal level when it has to do with access in the Forest Service. Next slide, please. But there's an ongoing need for action to improve safety, and that's really why we are so glad to be able to talk to you. So there's work to be done at all levels, but we really need to strengthen our presence and our knowledge at the local level. Next slide, please. So states need to pass bright line laws prohibiting OHV use on all roads, including the shoulder or any other part of the right-of-way. This is an offensive strategy, one that we very much support, but really we've been spending so much time on defense that we haven't been able to focus as much on offense, though we are working on this as well. Next slide, please. Letters I mentioned, and all of this is publicly available. But what we really need and what we don't have is the right messenger. It doesn't always make sense for an organization in DC to go into a county in Wisconsin to talk about the public health impacts. Usually a better advocate and a better messenger is someone in the state who knows the officials, who knows the key issues that would resonate in terms of articulating the public health message. So if you are interested in joining our coalition, please contact us and we would welcome your participation. Next slide, please. So in terms of strengthening our coalition, we really, as I said, are looking for partners to join us. We need to find out what's happening earlier so that we can engage earlier, and we need partners on the ground to help us communicate the hazards of off-road use in the right language that's narrowly tailored to the best messaging in that particular area. Next slide, please. Thank you very much.
You're up, Dwayne.
Hello, everyone. This is Dwayne Smith. We start with the slide, please. So just a quick reference on our hospital and the footprint we have in the Mountain West. We get the most severely injured kids, not only from Colorado, but the surrounding 7 states, and probably really 8 states. We get a good number from South Dakota as well. We do get kids from all 50 states. We are a level 1 verified pediatric trauma center, for those that are familiar with the classification system. Next slide, please. So just a quick overview of current off-highway vehicle law in Colorado. No one under 10 can operate an OHV. The key phrases in this law are people over age 10 must be a licensed driver or under the direct supervision of a person with a driver's license. So you have to figure out what constitutes within direct supervision or within direct visual contact, and how the Colorado Parks and Wildlife Department settled on this was basically because they defaulted to the BLM's threshold of 10 years old. So that's one issue we've been trying to fight, is raising that age. Next slide, please. So for some historical context, this is my 5th year in Colorado with the General Assembly and heading down to the Capitol to talk about these issues. There's been at least one ATV or off-highway bill that we've had a lot of success with in defeating or mitigating But these things aren't going away is my key point. So last year, a bill was introduced to expand off-highway vehicle access to county roads. We opposed that bill. How it ended up dying was basically because not anything that we did in particular, but there was a fiscal note attached to the bill that would have generated over $300,000 in registration fees. And in Colorado, we have a law called the Taxpayers' Bill of Rights, which basically says that any taxes that the state collects in excess of the state budget have to be returned to the citizens. So the extra $300,000 generated from this proposed bill would have come at the expense of providing $300,000 to the Department of Ed or another state agency, and it was just not a smart trade-off. So it kind of died its own death, the bill did. But in an effort to continue the discussion, they did establish an interim committee last summer to discuss the policy at greater length. Next slide, please. So we were involved in this interim committee, and one of the things we actually tried to do, there was language in the bill that established the composition of the interim committee, and we tried a tactic whereby we tried to insert language in interim committee parameters that said the committee should be composed of a member that is representing a pediatric verified level 1 trauma center, of which we are the only one in the state. So basically, we tried to get a provision where we had a seat at the table. That did not, we were not successful in that, however. But we closely monitored the meetings, and as Tony mentioned, he attended one with us. Basically, what we were striving for with the interim committee was not promulgating any rules that would make it more likely that kids or youth would be injured or fatally injured by using the off-highway vehicles on public roads, and that they should apply the results from the committee's work to adults only. Next slide, please. So this year, there is the current bill would allow counties and cities to create their own rules, of which they can create rules stronger than the 10-year-old lower limit for using the ATVs. They can require driver's licenses. We're neutral on this bill because we didn't feel like that it was in our best interest to compromise and say, okay, 10 is good. We had our speakers in a row. We had the Colorado State Patrol and various other occupant protection leaders in the state testify in the interim committee, and we pointed out the obvious, that we don't allow kids to get driver's licenses until they're at least 15 and a half years old, and there's certain steps you have to go through, and a vehicle has infinitely more safety features than an ATV or OHV. So why would you allow 10-year-olds to ride on county roads? That's where we are currently. Next slide, please. I did want to present a particular case study that highlights our use of data in trying to convey that the lax rules or laws that are being discussed have financial implications not only to hospitals, but to the entire state, and as I'll share later, to the entire Rocky Mountain region. So this particular incident is from Gilpin County, Colorado, which you can see a little red highlight in the county map in the upper left part of the picture there. This is a largely rural backcountry county. I think the population's less than 5,000. It's mainly old 19th century gold and silver mine towns that have boom and busted. The average elevation is about 8,000 to 9,000 feet above sea level. There's not a lot of resources there. Next slide, please. This particular incident happened on August 15th of last year. A family was camping. You can see just by the nature of the picture and the backcountry setting, there was a 12-year-old and a 10-year-old, both females, who were riding on the same ATV, a straddle ATV. They exited the narrow canyon dirt road that you see there. They traveled over 100 feet down a 40-degree hillside covered with rocks and boulders. Where you see the red arrow is where the most severely injured child, the 12-year-old, came to a rest. Miraculously, the 10-year-old was treated and released. She had only bumps, bruises, scrapes, things like that. But I'm going to concentrate on sharing what happened to the very severely injured 12-year-old. Next slide, please. So gaining access, pre-hospital provider access to this crash location is very difficult. The EMS was dispatched to the scene about 2:15 in the afternoon. They didn't get on scene until 2:44. Flight for Life, as you see coming in, didn't get there until 3 o'clock. Next slide, please. It was a very prolonged extraction from that ravine. The patient was secured to a Stokes basket. It required a 4-man lift up from the ravine. Flight for Life departed with the patient at about 4:46. And in emergency services and trauma, we talk about that golden hour, and this far exceeded that golden hour to try to get them into acute care. And for those not familiar with Flight for Life, pretty much just to crank the engine and turn the rotors on a helicopter or Flight for Life, the bill's starting at about $20,000. So the costs I'm going to talk about are not included in the Flight for Life transport. And that's a separate bill they get from the air ambulance service. Next slide, please. So this 12-year-old that was injured had an initial 45-day stay here at Children's Colorado. The acute care charges were well over $500,000. She had 2 subsequent inpatient surgical stays of three days each that were over $100,000. She's had 19 subsequent outpatient procedures for rehab, PT, OT, speech therapy. You can see the charges there. So as of last week, and this bill is still continuing to rise in the months to come, we're at $654,000. The primary payer was Medicaid. The approximate reimbursement you can see there that our hospital received was $137,000. For context, we get about 25% reimbursement from Medicaid on outpatient procedures, about 21% reimbursement on charges for inpatient procedures. The secondary payer was self-pay. Will ultimately end up writing off over $500,000 for care of this child in charity care. And I want to emphasize that this was a success story in that the child was saved, but nonetheless, there are resulting financial and economic impacts to our hospital, to the state, Medicaid. Next slide, please. So the next thing I looked at was our trauma registry for the 6-year period dating January 2010 to the end of 2015. There are 159 cases where we provided high-level acute care for ATV and OHV injuries. In 145 of those cases, we knew who the payer was. About 30% of the time, it was Medicaid. What was interesting was that 15 different state Medicaid plans were billed for the care. So that's why I say it's not just a state issue, it's a regional issue. We can reasonably infer without a deep dive that the states represented on the East Coast, like North Carolina, or the far West Coast, were probably here on vacation during the summer. But the total acute care charges were over $8 million, or an average of over $55,000 per incident. That's for all payers that we knew of. For Medicaid, those 44 cases, it was $2.5 million, or almost $60,000 per incident. And if anyone from our surrounding states in Colorado is interested, I have dollar figures for, I'll give you a quick example. Montana Medicaid got a bill for $239,000. Even Indian Health Services was billed over $19,000. So it has far-reaching impact from a financial perspective. And as Tony alluded to when he was with us in the testimony last summer, the one thing that really captured the attention of the legislators on the ATV interim committee was when we pointed out a similar case, and I believe it was a 13-year-old Colorado kid, where acute care charges were about $238,000, and we shared that the payer source was Medicaid, and how the state was going to end up collectively footing the bill for that. There was an audible response of surprise when we mentioned that. And even in cases where there are commercial payers where we're getting reimbursed for the acute care at a reasonable rate, if too many of those happen in succession or in a year, what's going to happen? Well, the commercial payers are going to raise their rates, so we all collectively pay for that. Or they're going to want to renegotiate a lower provider fee for those reimbursements. Next slide, please. So just sharing the continuation of our advocacy efforts. We have ongoing surveillance of all the injuries we look at, and of course with the OHV-related injury data. We do participate in our local child fatality review committees to add that perspective and look at the circumstances leading up to these injuries. We continue to inform lawmakers about these dangers and the resulting cost to the state and to nonprofit hospitals. We're continuing to work with Colorado Parks and Wildlife regarding the 10-year-old lower limit allowable to drive OHVs, and to the extent possible, monitoring the county policies on OHV regs. Next slide, please. I had a takeaway there, but I think those maybe got collapsed into a larger takeaway slide. But I did want to acknowledge that this is not just me working on this. We have several different folks from several different departments, including the business side and the policy side. So I would encourage folks that are working in this space to think outside the box, outside the trauma side of things and the injury prevention outreach side of things, to be able to state a case for the financial and economic impact to families and local businesses when these injuries manifest themselves. Thanks.
You're up now, Beth.
Next slide, please, Ruben. Good afternoon, everyone, and here I am. Special thanks to Ruben and Tony for inviting me, albeit last minute, to join in on this webinar. Very honored, and I'm really happy to be representing what Rachel would call the local level. I'm speaking to you today from North Country Hospital in the Northeast Kingdom of Vermont. The Northeast Kingdom is the most rural region of an already incredibly rural state, as you probably all know. We have about 15,000 registered ATVs, but that doesn't include all the ATVs that might be used for farming or maple sugaring or logging or timber harvesting. Like I say, that's just 15,000 that we know about. I'm a relative newcomer to this, I'll admit, and if you could change to the next slide, Ruben, maybe that'll explain why. At the end of last year, I, in my capacity as at North Country Hospital, I needed to do a major campaign as far as childhood injury prevention. And I had some ideas of my own, but then thought it might be a good idea to take a poll around the hospital and ask some of the doctors, specifically the pediatricians, to see how I could work toward best serving our local community. So I got some really interesting feedback from every person that I asked, every pediatrician, and I asked the Newport Ambulance Service, I asked the emergency room doctors, and the answer was always the same without hesitation, and it was ATVs. I didn't know anything about ATVs. I know a lot now, and I'm very lucky to have an ATV expert on speed dial. Thank you, Danny. I know you're listening. So I just started to ask questions. I Googled, I went around to my local ATV dealerships, I asked basic questions, and with every answer I got, it seems to provoke another question. And then I finally found my way to the Vermont ATV Sportsman Association, which is the umbrella organization for all the ATV clubs here in the state of Vermont, and that was a wealth of knowledge. Asked some questions of safe kids worldwide, and started to put together a program that has really been growing some legs. Since we're so rural, we don't have a lot of programs up here that other parts of the state might have. So one of the things I wanted to do was concentrate on getting some sort of safety programs up here in the Northeast Kingdom. And working with VASA, the Vermont ATV Sportsmen's Association, it turned out that they were wanting to do some courses up here too, and coincidentally, we were on the same page at the same time. Could I have the next slide, Ruben? Please.
Hang on 1 second. No.
No problem. So I was pretty much flying blind when I started at the end of last year. And here I am now on a national webinar, so I feel very proud of all the work that our team has done to get this far. What we really needed in the Northeast Kingdom, according to these pediatricians and the emergency room docs and the ambulance service, was we needed courses on ATV safety. And when I went to the local ATV club, the Borderline Ridge Riders, I was a little skeptical on how they were going to receive me, but the board of directors was thrilled to know that the hospital was actually working on an ATV safety campaign, and they became an active partner with the hospital and with VASA. And now the three of us together are moving forward so that we can have these ATV safety programs. The first one will be on April 23rd when VASA will come up and conduct classroom instructions. It's a half-day program, and that is designed for kids from 12 and over. And then in the spring, we'll be having our very first hands-on ATV training, which I believe is the first time in Vermont. Formerly, we had to go to Connecticut or upstate New York. So we're very proud to be starting that here in Vermont. I did want to follow up with something that Rachel said that struck a chord with me. In Vermont, ATVs cannot be used on the road unless, and there seems to always be an unless the selectmen or the trustees or the local government have opened the roads to ATV use and it's actually posted. But as she accurately said, when decisions are made like that on the local level, it becomes extremely confusing, and that's one thing that we're trying to deal with as well. It creates that patchwork that she so aptly referred to. So I suppose what I'd like to encourage everyone to do and to know is that even if you don't know anything about an issue, it happens to be ATVs in my case, there's always a great place to start, and that's by just reaching out in your local community and starting to ask questions. We're going to be making huge strides up here in Vermont. It's a complete grassroots movement, but I have high hopes that it's going to turn into something much bigger. And some of the things that they'll be teaching at the VASA Education Safety Training you can see on the slide, just common ATV parts, inspection of your vehicle, speed and stopping, crossing roads and highways, which is a big issue, and there'll be so much more. And I just also wanted to give a plug for Vermont State Police because they also do an online training course if anyone is listening from Vermont. And I just want to thank all of you, and if anyone has any questions, my information will be on the next slide.
So actually it won't, Beth. It's on the very last slide, and we're going to provide this to everybody. Just some very quick takeaways from this, and I'll be doing takeaways for the takeaways because we have a lot of questions, and I'd rather get to them. The numbers involving kids is pretty compelling. 30% of those who died weren't wearing helmets, 50% not wearing seatbelts. Most OHVs deaths occur on public roads, as was an important point for both Rachel and Michael. They need, and we need, your on-the-ground intelligence of what's going on at the local level so we can react. We need to build this partnership. I think that Dwayne really provided a lot of guidance, not only for this issue, but for so many on the value of data and cost in a way that that will influence legislators to think twice or three times about the implications of what they're doing. One thing that state legislators everywhere are concerned about are Medicaid dollars, a huge driver budget-wise. So let me get to some of these questions, and starting with Gwendolyn, the slides will be available after the presentation. We'll get them to you. And I think it'll be in an email that asks you to do our evaluation of this and of this program, so we know how we did, how we didn't do, what we could do better, and what more you want to see from us in terms of webinars like this. Jennifer asked, what else is included in the ROV category? Please review again, as this was run through very quickly.
So the ROVs, we define those as they're going to be the sort of the bucket type seating, the car type controls, pedals, and steering wheel, and a speed of over 30 miles per hour. So that's the key part that differentiates it from what we classify as a utility trained vehicle, which can often look the same or have more sort of bench type seating, but the maximum speed of that would be under 30 miles per hour. So the ROV category that we're talking about is that 2 or more seating, over 30 miles per hour, generally has some kind of roll cage.
You have to click on thanks, Michael. Next question is a question about helmet use. Where I imagine they're all over the gamut, but Regina's wondering what are the laws on helmet use on OHVs, ATVs, ROVs?
It's really going to vary, and that's actually a long-term sort of legal research project. Actually, I'm working on sort of doing as I can, but as you might imagine, I mean, every state's going to be different. So it's a big nut to crack, and I don't actually know of a source that lays that out right now specifically. So it's going to run a gamut depending on your state.
Thanks. Joseph Palella asks Dwayne especially about the balance of kids who are riding these things. What's the balance between doing it for recreation and for transportation?
Good question. I'm not sure I have a good answer. In the western part of our state and on the eastern part of our state where the Great Plains end, we have counties that are classified as frontier counties, which is more rural than a rural classification. Certainly, I'm sure there are kids that are riding ATVs to school or into town on a regular basis, and as was mentioned previously, for agricultural or livestock work. I don't have a good answer for that, Joe.
Okay, and as Beth said, I mean, sometimes the ATVs and OHVs are used in Vermont, for example, for providing us to market some great maple syrup. Sarah Peniston in Alaska is very appreciative to you, Dwayne, for presenting the cost analysis, and wondering, for those of those who want to look at this, what are the ICD codes that they should be looking at to access this kind of information?
Sure. So folks may be familiar with the transition from the old ICD-9 to the ICD-10, which the 10 is going to be a whole lot more descriptive. So what I'd suggest is, if you have ICD-9 data that you're looking at an E-code of 821.0, 821.1, and 821.2. And within ICD-10, you're going to look under V86, 86.0, V86.09, V86.1, 86.39, 0.59, 0.6, 0.61, 0.79, and 0.99, and I can send this page to Tony to include in the notes for the presentation, so that you don't have to scramble to try to look at those. Also, I would suggest inquiring with your state hospital association and their inpatient and outpatient databases, their emergency department utilization. Most frequently, I've found if you can kind of narrow that search down for them with specific codes that you want them to run a report for, it's a lot easier for them. Hopefully, most hospitals have transitioned to ICD-10 reporting this past fall, although I'm not sure what the landscape is around the country with every state.
So, and this will be the second to the last question. The wonderful Alan Della Penna from North Carolina asks a great leading question for Rachel, which is, are there upcoming regulation changes by CPSC on ATVs, OHVs, ROVs, and can you provide a summary of what is in the works, or, wow, what might not be in the works?
Sure. That is a very timely question. So I'll start back to the Consumer Product Safety Improvement Act, which passed in 2008. That law included some all-terrain vehicle provisions which codified the voluntary standard and made that mandatory. It also directed the CPSC to move forward on an ATV safety rule. That has still not yet happened. So we are still waiting for that. In terms of recreational off-highway vehicles, has been working on a mandatory rulemaking to address the safety features of recreational off-highway vehicles. It has been very controversial, and there were bills and then ultimately language included in appropriation bills that would have prevented CPSC from moving forward on the rule. The Recreational Off-Highway Vehicle Trade Association opposed the rulemaking, and ultimately that appropriations language passed, which means that CPSC, at least for this fiscal year, can't move forward on the rulemaking. Yet, what this dynamic also did was move the parties who were working on the voluntary standard, and CFA participates in the voluntary standards as well, and the voluntary standard was strengthened more than it has been in the past. So what will be happening is that this voluntary standard will be finalized in the next few months, and CPSC will no longer be working on the mandatory rule this fiscal year, but it will give some time to see if the voluntary standard is in fact working and deaths and injuries decrease from the changes made to the voluntary standard. I think what all of this shows is there's so much more work that needs to happen on these issues, and we need more feet on the ground all over the country as well as in DC.
Thanks, Rachel. Dana has a great question about whether it would be a great idea to have an infographic for the public on some of these issues, and I'm going to hope that all of us can work together on something like that, unless there's something that already exists. Last question, and it's a long one from Melissa, but a good one. She's curious about whether there's been crash testing that it has been done on ATVs or ROVs, similar to NCAP or anything that IIHS has done. Were dummies used? If this is not typical, should we raise this with the IIHS, that's the Insurance Institute for Highway Safety, and could be very useful in terms of some of these advocacy efforts. I don't know who would be best to respond to that, but so I'll leave it open.
I would agree that it would be. This is Rachel. I would agree that it would be great if it were to happen. IIHS, profoundly important and exceptional organization, does not do crash testing on ATVs. We believe that there has been some of this testing overseas in Australia, and our assumption is that the CPSC and the industry, in terms of movement on the voluntary and mandatory standards, has done some of this testing, but that information is not fully public. But it would be outstanding if we had that type of information.
Australian front, the issue there. We've worked and presented some of our data to committees that work on rollovers, and Australia's done quite a bit of testing on that in the work environment. Whereas here this is more of a recreational issue. It's more of a work-related issue in Australia, there have been some corner inquests over there. There's some good materials that obviously not having to do with the states, but I think can be useful in this advocacy.
If you want to talk for a few seconds about the BLM and the 10-year-old helmet issue, that would be great.
Yeah, so Tony, I actually have a request for consideration at the federal level. So as I'd mentioned, our Colorado Parks and Wildlife had defaulted to the 10-year-old lower limit for ATV use on BLM land. Should that request to raise that to 15 or 16 or whatever is a political reality in the discussion, maybe start in D.C. with Department of Interior or BLM or whomever, so that states can't default to a lower age limit. Hope that makes sense.
Okay, so we also have, I think, a bunch of things that we can share with you in follow-up, and maybe a few of these other questions that haven't been answered. Just a few things to wrap up. We will be sending this around and sending to you all of the contact information in a follow-up email to you. Please, as I said before, answer the survey. And especially what other kinds of webinars can especially the Safe Kids use in their work. This is available for chess credits, and I'm sure you know much better about what you need to do to get those chess credits than I do. And I think that's it. I really want to thank Rachel and Michael and Dwayne and Beth for helping us out today with this. and there's more work to be done. Thank you very much, everybody, and talk to you soon.